task of on the fly giving you some takeaways from what we've heard so far. So some of the themes that I've been hearing from these wonderful set of talks is that we need tailored approaches to our interventions, but we also need these approaches to be scalable. So these can really be two concepts that are at odds with each other. And so how do we achieve both of those goals? So from Paul Heider this morning, or our first talk on algorithmic bias, the big takeaway that I took from that is that we need to be careful about what data we're feeding into our models and making sure that that data or that those data are not causing harm because of the bias that might be fed in, and that while we can try to improve data, it's going to be a big haul to improve data sources. So we also need to think when we're using these algorithms and developing them that we need to be cautious about really addressing those biases that are going in. In terms of delivering and anticipating and delivering services in pandemics, Leah Rennert's talk, we can really gain so much from deep data to identify hotspots and also identify real need. And I think that that was a really important point to make, that we're looking for both of these in consort. We need to identify where is the lack of resources, where are the hotspots, and target our efforts to the intersection there. And to optimize the locations where we want to send our resources. And while a lot of this is, again, automated data that we can use in dashboards, there's also a role for community partners and going out into the community, knowing where those best sites are to locate our resources. So we're never going to obviate the need for those relationships. When Guilherme talked about how do we improve the knowledge of and uptake of testing for genetics, but then also lots of other applications. This is an arena where with genetic testing, we need automated scalable approaches to identify who's at highest risk and can benefit from genetic testing. There's, as we move genetic testing from this new emerging innovative sort of intervention that's done at academic medical centers to a goal of having genetic testing be widely available and accessible, there's going to be a need for less intensive interventions. And how do we implement chatbots and algorithms to make sure that we can reach as many people as possible? So I think the algorithms to identify patients paired with chatbot style automated information makes genetic testing access more scalable. We're optimizing what can be done with chatbots and what requires, again, a conversation with a patient. So being cognizant of what the limitations of the chatbots are and when you need to bring in the genetic counselor is still important there. I really love to see across the talks the opportunities for applying the systems that are developed in one context to another context, because we have a lot to learn from each other. While a system might be developed for nutrition or for genetics, these same concepts and ideas and tools that we develop in the EHRs can be applied widely across different intervention or disease arenas or programs. So being able to know what's going on, I think, is really critical to our ability to implement across systems. And I appreciated that the GUARD program is funded particularly to try to disseminate that type of system widely across studies. So I hope that people take advantage of that opportunity. I got to sit next to Deborah Tate last night at dinner as well and learned a lot about this precision nutrition program. So here I I think this move from we've learned a lot about what works for the majority of people, what diets work most well for the majority or the highest number of people, what messages work best for the majority of people. I think even with COVID vaccine uptake, we saw a lot of efforts to identify like what are the text messages that we can send that are going to work for the highest number of people. While that is important and useful and scalable, we also really need to consider the differences and heterogeneity among patients and people in terms of their needs for what type of prescription or plan or recommendation they're getting, and then also how you're giving that information. So I think that that can often get lost when we try to find the best approach instead of these more flexible, individualized approaches. And again, like how do we move towards that type of thinking and still make it scalable? So how do we build in automation to respond? So I think this approach of getting the feedback of did that message land and what message does that individual need going forward is really, really valuable. And the two lightning talks that we just heard, amazing work. I think that this need to reevaluate the frameworks that we've developed to be more culturally appropriate is really a key takeaway from Diana's talk. So we need to adjust our models of health behaviors to be more culturally relevant, to take into account cultural values, family dynamics, changing dynamics, and heterogeneity within communities that we consider as a population group that is really more dynamic and diverse than that. And also Grace's talk hit that point as well, that considering diversity is so key when we're trying to improve our reach of our programs, that diversity is not looking at monoliths, but that each of the subgroups of the population that we're interested in is really much more diverse. And so bringing in many voices and advisors when we're developing, whether it's translations or other types of materials or interventions that we would like to reach the most different types of people as possible. So those were my takeaways, and I'd love to give people a chance to talk at lunch. So what we're going to have now is lunch will be available outside. Posters are still up. I know there are a lot of conversations that people probably want to have. We're meeting back in here at 12:30 for the community panel. And you're welcome to bring your lunches in here afterwards. You're also welcome to take your lunches outside. I think it's a beautiful day out there. So go have lunch and we'll meet back here at 12:30. Thank you.